You said at one point that you thought maybe the apex here in New York might be, it would be April the 15th, which would be 1 week from today. Is that still your best estimate?
You know, Dave, thanks for having me on, David. We are starting to see a little bit of flattening. So our best estimate is still right around that time. But hopefully I'm wrong, and that we see by Saturday a real trend in flattening. That would be certainly the first piece of welcome news in a while. So I'm hopeful.
And Dr. Corwin, how are the hospitals holding up? How's your hospital holding up? When we hear things from the governor like it's redlining, can you sustain the present level of activity for very long?
You know, I have to tell you that our staff has just been remarkable. We've redeployed 2,000 physicians, 1,000 nurses, 500 general workers. We've gotten 2,000 people to volunteer. We have pediatric nurses delivering ICU care. We have our chief of dermatology functioning in the emergency room. We have our chief of cardiothoracic surgery functioning as an ICU doc. People are just going to extraordinary lengths. It's really remarkable. How sustainable is it over the long haul? It's not, but we think we can pull through this crisis and that we're not going to break.
Well, that's very encouraging news. When you talk, Dr. Corwin, about redeploying people, I think you're talking within New York-Presbyterian. We also hear from Governor Cuomo a lot about redeploying physicians and nurses and other healthcare professionals among different hospitals as they reassign. Is that working well? Are you giving people to other people? Or are they giving them to you?
I'll give you a perfect example. One of our affiliated institutions, Hospital for Special Surgery, they stopped all their elective surgery. They've assigned a lot of their nurses and physicians to us, so that's an example of volunteerism. We've had people from around the country volunteer. We were on the phone yesterday with Mark Larrett from University of California, San Francisco. He's putting a team together for us. So the response around the country, the American spirit, has really been remarkable and very heartwarming for me.
And do you have a sense of how it's going in New Jersey, for example, our adjacent state here? They seem to be really still on their way up. Are they asking for help as well?
You know, David, I don't know the specifics in New Jersey. I know that Governor Murphy said yesterday that they were on the way up. What I hope is that no state goes through what New York City and its surrounding counties are going through now. And I would just urge everybody to recognize that these social isolation and stay-at-home orders have been effective. I know in California they've seen much less in the way of this than us here in New York City, and I think part of that may have been an earlier application of the stay-at-home that Governor Newsom did, and I'm hoping other states follow suit on that.
So, Steve, that really leads us naturally to the next question, and we want to be careful of this question because we don't want to declare victory too soon and go back to a bad old situation. But we are starting to talk about now a plan at some point in the right situation to start reopening some of the economy. How do we develop that plan? How do we make sure that we don't revert at the same time as we have to go forward?
Well, that's the million-dollar question. I think that the worst thing we could do would be to start prematurely and then lose the confidence of the American people and have to go back to where we are. And believe me, I recognize the millions of jobs, the recession that we most assuredly will enter, whole industries being stopped, the economy basically being stopped as a whole. I think that my expectation around this is that, on or around in the June or July timeframe, we're probably going to do some of that. The way that I would look at it from the personal situation in New York City is when I start seeing the decline and the return more towards normality, we're going to be in sort of phase two. Phase one being the upswing. Phase two being we're still living with the virus, but it is more controllable than what it was. And then phase three, probably, third, fourth quarter, we're talking about can we get back to a more normal situation. I would say that what Dr. Fauci said really is ultimately where we have to be, which is a vaccine and treatment, because I think the virus is going to be with us for a while. I hope we don't have a recurrence or a recrudescence of a real spike in October. And you've seen that if you release these things too early, you get another spike and you're back to square one.
As we talk to experts about the possibility of reopening, the thing we hear again and again and again is testing. We have to know whether we really are controlling it sufficiently. Where are we in testing? It appears we are not to the level we need yet of broad testing across the population to really come back safely.
I don't think we certainly have enough testing. In my hospital system, we have enough testing to test everybody that needs to be tested. But we're not at mass population screening. That's with the PCR test. That's one type of testing. And the second type of testing that everyone's working on is the serologic testing or the antibody testing. Were you infected with it, and does that confer immunity on you? You know, you're still looking at 90% of the population that probably has not been affected by it. So the question starts to become, do you get some herd immunity? Do we have evidence of that? Are we sure that if you've been infected and you have the antibodies, that you're not going to get reinfected with it? These are still scientific questions to be determined. But I think, to your question, we need more testing, the PCR testing. Do you have the virus or don't you have the virus? And we're going to need to apply the serologic testing to determine what percentage of the population actually was infected by it, and are we starting to develop herd immunity as a country?